and welcome to our webcast for April 12, 2019. My name is Christian Debré, and this is Amy Asbrook, the director of Toujours Vivant, Not Dead Yet.
Hello.
Also joining us, Taylor Hyatt, just over there. Okay, our policy analysis and outreach coordinator. Toujours Vivant is a non-religious organization by and for people with disabilities and our allies. Our goal is to inform, unify, and give voice to disability rights opposition to assisted suicide, euthanasia, and other ending of life practices that discriminate people with disabilities. Today's topics: the summary report on end-of-life care in Quebec. Old data.
Yeah.
The second one is assisted suicide bill in the US.
Okay.
So Amy Asbrook will help us through those subjects.
I'll do my best anyway. Okay, so the first topic is the summary report on end-of-life care in Quebec. And this is Quebec's Commission on End-of-Life Care has issued a summary report on the status of end-of-life care in Quebec. The report deals with palliative care, continuous palliative sedation, or CPS, euthanasia, administered or not, and the activities of the Commission itself. But the document only includes data up to through March of 2018. So all of the data is at least a year old, which is a little odd that they should produce a report and go through this big flu-fla when they released it with press releases and everything, and the data was a year old. Very strange, but that was what they did.
Are they expecting people not to read closely enough to know how old it is?
I have no idea what we're thinking, but be that as it may. Should be noted that it's actually very difficult to get a link to the report. I thought I had sort of managed it, but I think we've corrected the problem in the version that we're going to post on our website. But note that by clicking the link above could produce an error message. If you do a Google search on the PDF of the report, and the number is listed in the text, the results will include a link to the page at Quebec's National Assembly where the report can be downloaded, or you can just do a Google search on Quebec End of Life Commission report, and that should pull it up. But it's only in French. The report presents some obvious findings. The number of euthanasia and continuous palliative sedation are increasing. Some doctors, hospitals, and regions provide more palliative care, continuous palliative sedation, and euthanasia than others. And most of the people, most of the people who die by euthanasia and continuous palliative sedation are over 60 years old and have cancer. Big surprise. Yeah. So yeah, there's lots of obvious findings, and that was mostly what they had in the press releases that came along with the report. The report identifies some problems, such as that the Commission doesn't have the data necessary to say how many people who need palliative care aren't getting it, but we are aware of and can predict other problems that are not addressed by the report, such as that people are forced to live in institutions, are requesting and receiving euthanasia.
And we know that people with disabilities who would rather not live in an institution are forced to live there because of the lack of community care available to them. Yeah. How many people feel so desperate that they see assisted suicide as a way out? And to my Albertan friend watching this episode today, take note of this fact.
Yes, exactly. And, you know, they talk about palliative care, but they don't talk about home-based personal assistance services, which is what people need. Also, we don't know how doctors decide if a person is subject to external pressure to request euthanasia, and whether psychosocial, economic, or discrimination-related factors are taken into account besides abuse and coercion. Because there's no explanation of how the doctors are supposed to make that assessment, and there's no statistics related to it. So we don't know. Okay, let's start with the palliative care. The Commission admits that it doesn't have data to prove that the gaps in palliative care services observed in a report published in the year 2000 still exist, but they're pretty sure that's the case.
And we are sure too.
Right. So 20 years or almost 20 years later, not only can they not verify that the situation is better, they don't even have the information to show whether the situation has improved.
The government doesn't collect the necessary data.
Right. The only data available count people who are receiving palliative care services and those who apply for euthanasia. So we know who's getting the service. We don't know who needs it and isn't getting it. That's the problem.
Right. For a lot of our work, we commonly use a stat relating to palliative care access across Canada, but even that number goes back to 2014. I'm working on digging up some more recent numbers, and I'll let everybody know when I find them.
Yeah, if we find them.
Thank you.
Good. Service gaps exist in all areas where palliative care is delivered. So home hospice care, hospital-based palliative care units, and freestanding hospices. There are service gaps for all three. The report focuses on palliative care as an option only for people at the end of life. This despite the fact that effective pain relief is essential for many people with disabilities, and the authors propose expanding euthanasia to people who are not at the end of life. Oh. Yeah. The section on palliative care doesn't address services to prevent institutionalization and requests for euthanasia, which are central to the Truchon, Gladue, and Lamb cases. Things like, suicide prevention services.
Oh, yeah, that's just a small thing.
Yeah, okay. Continuous palliative sedation. Of the people who died by continuous palliative sedation, the report provides more detail about symptoms that justified CPS than about the kind of suffering that leads to requests for euthanasia, oddly enough. I don't know why they were more specific on this than about the reasons people asked for euthanasia, but be that as it may, people who cited psychological or existential distress was 58%. And again, they say that if you are depressed, you're not supposed to be eligible for assisted suicide or euthanasia, but apparently, because continuous palliative sedation, the eligibility criteria are much looser, then it's okay.
Yeah, but the 60% is so high.
Yeah.
It's unbelievable.
Right. Physical pain was cited by 28%, and that could also include the fear of pain. Difficulty breathing was mentioned by 25%, and delirium and agitation, which would also be a situation where a person wouldn't be eligible for euthanasia, but is eligible for continuous palliative sedation, was mentioned in 20% of the cases. 94% of the people filled out and signed the consent form. In the other cases, the form, actually, I should say 94% of the forms were filled out and signed.
First, it's looking nice,
right?
But look that way.
Right.
You play with death and people, okay? And let's say it like that. If 6% of plane doesn't cross the ocean, did you get it?
Right. Exactly. Yeah. So in the other 6% of cases, the form was not signed, but was in the medical file. And again, remember that with continuous palliative sedation, it's the person doesn't himself or herself have to make the request. It could be a request by the family. The form was missing from the file. Oral consent was given. At least somebody said oral consent was given by the person or their family. And the form was also, the other option is the form was not signed because the substitute decision maker was absent.
But the guy or the people died.
Right. In any case, yes. According to medical records, 83% of people received palliative care before asking for continuous palliative sedation, and 6% never had palliative care. So that's not good because, again, there were supposed to be exceptional cases.
Yeah, and they are supposed to receive. Sorry.
Okay. Let's see, information was not available for the remaining 11% of cases. So 6% didn't get palliative care. We don't even know about 11% of the cases. So 81% died within 3 days of when CPS was started. So it was quick. Go ahead.
Sorry. Can we talk a bit more about what continuous palliative sedation is? I've seen it used almost as a rhetorical device by people who are both for and against euthanasia. But it's not the same thing as euthanasia, and it might hasten death, right?
Right, exactly. It really depends on what other care is being provided at the same time. Sometimes continuous sedation is accompanied by withdrawal of food and fluids, and that means that the person is dehydrated to death, and that hastens death. Sometimes it's just provided and the person still has IV fluids and nutrition and antibiotics and whatever else they need. So that would mean that it really was just the person's underlying condition that was causing death.
But because the law says it's continuous,
there's no interruption.
There's no interruption. You will die.
The person
whatever the time it takes.
Right. The person is not woken up, brought back to consciousness to confirm their choice.
Even if they are doing better.
Right. Exactly.
And it happened.
Right. Okay. So on to euthanasia that is administered. The number of requests was 10 times more than anticipated before the program started.
Let's say more 100 times.
Yeah. They said that this was supposed to be an exceptional measure in exceptional cases, and that ain't the case. According to the data gathered by the commission, 1,632 people received medical assistance in dying in Quebec between December 10th, 2015 and March 31st, 2018. Remember, this stops at last year. Footnote 33 states that the commission is aware that the total of MAID, 2,632, does not exactly correspond. I'm sorry, what?
That was 1,632, not 2,632.
I'm sorry. Yes. 1,632 does not exactly correspond to the total declared in the reports from institutions and the Collège des Médecins du Québec, shown in the latest report of the Commission's activities, which was published in December of 2018. That figure was 1,664, a difference of 32 euthanasia.
And this is accounting.
Right.
Accounting of death. Right. And when you do accounting for money, you doesn't balance. It's very, very, very strict. Okay?
Right.
And you play with death of people, and it doesn't balance.
Right. The commission does not explain the discrepancy. It just says it doesn't exactly correspond. Well, exactly correspond in 32 people is pretty big.
Yeah.
Yeah, we talk about these as stats, but these are lives. These are people we're talking here.
Yes. It's lives of people.
And the fact is, we know that 4% of them are not compliant. So that means one of those people wasn't compliant. They're euthanasia didn't comply with the eligibility requirements or the safeguards.
And this is only the official number because there is unofficial.
Right. It's unclear whether the 1,632 figure comes from the total reported by institutions in the CMQ or from doctors' forms. In fact, nowhere in the 124-page summary report does the Commission explain why the number of euthanasias reported by institutions in the CMQ has always been higher than the annual reports than the number declared by doctors. I mean, basically, what we're saying is that there are two ways that these are reported. And the reports that come in from the institutions, there's a higher number than those that come in from the doctors. And that means the doctors aren't reporting euthanasia that they perform. And that's not good.
No. We already know that in the monitoring system, there's no consequence for missing reports, but could they be using different definitions depending on what kind of facility you're working out of? And for institutions, could there be rogue staff deciding to put people out of their misery? Is that picture too extreme and too off?
Hard to say. Hard to say.
Maybe not.
And, you know, at the federal level, there isn't even this sort of check, this double verification system. Of the doctors' declaration forms submitted to the Commission, 84 came in more than 6 months after the euthanasia was provided. They're supposed to come in 10 days, more than 6 months. Okay. By the Commission's count, more than 60 euthanasia forms had not been reported by doctors as of March 31st of last year.
Unbelievable.
Yeah. So they hunted those down while they were writing this report. But even in the end, 11 doctors' reports were still missing when the summary report went to press. So they know 11 people were euthanized, but they don't have any doctors' reports about those people.
So it may be homicide.
They can't evaluate a report they don't have. They know the person was euthanized. As well. But there's more.
Yeah, there's more all along.
Right. As well. But mentions around 20 euthanasia that were not reported by the doctors or by the institutions, but which came to light following audits by institutions that found the information in their pharmacy records.
Almost by a...
What on earth?
Well, you know, the pharmacy has to medicate the, I shouldn't say medication,
only
the
in
drugs.
Quebec. Only in Quebec.
No, I think this could work elsewhere, but pharmacy has to issue the drugs to kill the person.
Yeah,
and
but
it's a certain number of drugs and it's a high dosage. And somebody noticed, oh, look, there's these drugs for
in
euthanasia.
Quebec, somebody have to pay for the medication.
Right. Yeah.
And there is a bill somewhere.
Right.
That's the thing.
Right.
And you would know if you were going through your pharmacy records, oh, if you have a high dose of this medication, there might be only 1 or 2 things it could be used for.
Right, exactly. So, oh, look, somebody issued a prescription for these dosages of phenobarbital or whatever. That must be a euthanasia. But, gee, it isn't attached to any reported euthanasia. Where did that come from? Well... and it says in French it says une vingtaine, so it's around 20. So these 20 odd people, plus or minus, we don't know how many of people were euthanized, but no record exists in the system.
Unofficial, but founded. But it may exist some who are not found.
Right, exactly. Right.
And some of those cases could be murder.
Right. we just don't know. And this is after just a little over 2 years of the program being in operation. And everybody's talking about, oh, how well the program works.
And the problem is not the fact that it missed something or not. The problem is there's nobody do any inquiry.
Right.
Right. And to my friend who's watching, what discussion did we have about the million holes in the monitoring system?
Yes. Yes. And in fact, that's an important point, because Quebec has this 2-track monitoring system where they have the reports that come from the institutions and the ones that come from the doctors. The federal government doesn't have that second track. There's no way via the federal government to trace euthanasias except by the doctors reporting it themselves.
And they're missing some report. It will be the same in Canada for whatever to happen in Quebec.
Yeah.
We are the same people.
Right. Yep. Okay. The average time between the person signing the request and the administration of euthanasia was 12 days. So that is for all those people who say it takes so much time between the request and the euthanasia. It doesn't.
And it is the average.
Yes, that's the average. That means there's less.
So it means that because there's many people who have a prognosis of 6 months or a year who are eligible. So a lot of people were killed under 12 days.
Yeah.
And a lot under 10. Right. With the it's possible.
Yeah.
And on top of that, we know that the 10-day requirement at the federal level can be waived.
Yes. Yep. And there actually is no specific waiting period required in Quebec. All right. The commission describes the reasons for euthanasia requests, suffering, in the broadest possible terms. Physical suffering, psychological suffering, or both. So we don't have a lot of specific information. Not surprisingly, 89% reported both. The report did not specify how many people had what kind of discomfort, like physical pain, breathing problems, nausea, or existential suffering, feelings of loss of dignity, problems with self-esteem, grief, etc. So they just didn't even touch that, which is really unfortunate, because we need to know why people are asking in order to prevent it.
Okay. Or at least to know if the law doing its job.
Right. Yep. Okay. But one thing to note is that the commission appears to have checked off physical suffering even where it wasn't an issue. Footnote 43 states, quote, now this is my translation. In light of the totality of information listed on the forms, physical suffering was determined to be present even if the form indicated that it was well managed or that there was only minor physical discomfort. And the people who promote euthanasia do so on the basis that it's physical suffering, pain.
Yeah.
And so if they're inflating the figures, that's not fair. Cheating.
Check burn.
The commission says that 80% of the people who 80% of people were receiving palliative care when they requested euthanasia, and 89% were getting it when euthanasia was administered. Again, exceptional cases for exceptional situations. No, they're supposed to have been getting palliative care before they make the request, but obviously this is not happening. Only 4 in 5 people had it. However, the commission makes no assurances as to the quality or quantity of that service. So a person might have had one visit from a hospice worker and they got counted as having palliative care services.
Even a single shot of pain relieving medication could be
or just a visit from a palliative care worker who's evaluating them for palliative care services. They're not even on
palliative care.
Right. They're on the wait list, and they were,
counted as receiving it.
The services. The percentage of palliative care services is higher than that reported in a study from McGill University we reported on last December. And you can, there's a link on our text to go.
Yeah, this study is maybe closer to the reality.
Hard to know. Hard to know.
Probably.
The authors note that the number of euthanasia performed at home in Quebec, 20%, is half that of other parts of Canada, where it's greater than 40%, and Europe. Some people were admitted to hospital just to be euthanized because there was some problem with doing the procedure at the person's house. Okay, the commission estimates that there could be up to 1,500 euthanasia performed in Quebec during the fiscal year ending March 31st, 2019.
And it's supposed to be an evaluation.
Right,
but we are
estimation
past March 2019.
They published the report on April 3rd, which is after the end of that period. They shouldn't be guessing. They should know the number.
Okay, except the report to our late.
Right, which is a whole bunch of
more than 60.
Yeah, well, that was from before.
Yeah.
The data confirm the theory that there are a few death doctors who specialize in medical homicide, plus many other physicians who do 1 or 2 euthanasia per year.
Okay, those ones are kind of respecting the law, but the death doctor are kind of...
Well, they're specialized.
You go there, you are dead.
They're specialized.
Basically.
Yeah, that's their raison d'etre. Okay, the next section is euthanasia not administered, because obviously some were refused. Of the 2,462 requests, 830, or just over a third, did not result in euthanasia. Such requests were not reported, so the commission had to look at each medical record of the people who made the request to determine what happened and to learn why euthanasia did not take place. The reasons fell into 3 broad categories. First, the person was deemed ineligible. The second is that the request was withdrawn, or the person decided that they basically changed their mind, or the person died before euthanasia could be carried out. So those are the 3 possibilities. The reason euthanasia was not administered, okay, the person was not eligible when the request was made. There were 191 of those people. And here are some of the reasons why that was the case. Either they were not at the end of life, and that was the case in 97 for 97 people. They were incapable of giving consent when the request was made, 58 people. They did not have intolerable suffering when the request was made, 48 people. They did not have a grievous and irremediable medical condition, 37.
Talking about pain, I have to take
an extra pill.
Yeah.
Okay.
Sorry, I'll be back.
Their medical condition was not in an advanced state of irreversible decline, and that was 35 people. And keep in mind that some people were ineligible for multiple reasons. So one person might not have been at the end of life, and their condition may not have been in an advanced state of irreversible decline. So they had multiple reasons they weren't eligible. Another reason people might not have been eligible, they might have become ineligible during the evaluation process because they lost capacity to give consent, and that was the case for 156 people, or their suffering was relieved such that it was no longer intolerable, and that was the case for 3 people, though they didn't withdraw their request. And there were 5 people where there was another reason. The person died before the evaluation was completed. That happened in 168 cases. The person withdrew the request or changed their mind, and that happened in 167 cases. The person died before euthanasia could be administered. That happened in 67 cases. And there were other cases or information wasn't available, 73 people. Again, these are people who were refused for whatever reason, but not enough information was provided. The authors note that the variability between different locations comes from diverse interpretations of eligibility criteria, especially end of life and constant and unbearable suffering. So different people interpret things differently, and that's why some of the reason there's variability. And they go into that more, but we decided that that wasn't all that important given how long this is going. Okay. The commission suggests that the fact that 51% of people who asked for euthanasia were not at the end of life and 30% were incapable of giving informed consent corresponds with the public's desire to expand eligibility to these populations. Our view, on the other hand, is that the fact that some people are excluded means the eligibility criteria are working at least somewhat. So there should be some people who are excluded. That's why we have exclusion criteria. And of course, that means it's working, sort of, at least some. But, you know, the press releases and the press coverage, people were saying there should be nobody who was being refused, which is ridiculous. Okay, the next section is about the application process. Oral requests were often not documented in the request form until the evaluation process was nearly completed. So somebody might say, I want euthanasia, and they went through the evaluation process before even writing down the request, which was a little funky. The authors say people are being discouraged from making a written request for euthanasia, and are being told informally that they would not be eligible. So that, you know, I don't know where that comes from. I think that's the commission saying, you know, this process isn't going the way the commission wants it to go. But I think, in fact, probably there are a lot of people who are not eligible who are asking for this. And finally, the commission downplayed the problems with delays in receiving forms and the numbers of errors and incomplete forms. They didn't talk about that at all in this summary report, though they did talk about it in the annual reports and how many errors were in the forms. Okay, the next section is the activities of the commission. The report says nothing about what the commission intends to do about the deaths of people who were deemed ineligible, or where people were deemed ineligible or where the safeguards were not complied with. So in 11 cases, the person was not eligible for euthanasia.
That's at least 4 more than last year. I went back to the previous report, and the closest number to that I could find was 7.
Yes.
That seemed like a big jump to me.
Yes. So that means that the cases that they recuperated during the year of putting together this report, they evaluated additional cases and they found 4 more people who were not eligible for euthanasia, who were euthanized nevertheless. And that's, no good. In 10 cases, the doctor didn't talk to the person to ensure that they were giving free and informed consent and as to the persistence of their suffering. So, yeah, a safeguard, a very important safeguard. So that basically the doctor delegated that conversation to somebody else. In 9 cases, the consulting doctor examined the person before the euthanasia request was even signed. So again, getting things backwards. In 5 cases, the form was countersigned by someone who was not a healthcare professional.
And again, for my friend who's watching this, I mentioned this stat to you this week.
Yes, exactly.
Mm-hmm.
And in 2 cases, the doctor did not assure that the safeguards were complied with. And in Quebec, that's all the safeguards. So the doctor didn't, him or herself, ensure that the person met the eligibility criteria and that all the other safeguards were complied with. Yeah, it's not just a question of paperwork, please. These are people's lives. Okay. The Commission's backlog of evaluations is glossed over in the report. They've evaluated 1,498 of the 1,632 euthanasia declared, or 92%, leaving a backlog of 134 cases even a year later. That's, yeah. So this is especially pressing given the Commission's estimate that the number of euthanasia for the fiscal year just ended could be up to, what, 1,500, even though they don't really need to give an estimate. They should know how many euthanasia happened in that last year. So they're already 134 backlogged, and they haven't even started on this past year. Oh boy. There were references to improvements promised by the electronic reporting system, but the report skips over the problem mentioned in the annual reports related to how many forms were incomplete or have errors, how many letters and phone calls were necessary to correct or complete the forms, or to track down missing forms, or the euthanasia reports that were not transmitted at all. So nor is there any discussion in the report of how the problems will be dealt with in the future, other than, well, now we have this wonderful electronic reporting system, everything's going to be fine and dandy. Yeah. The media coverage of the release of this summary report was a frenzy of pro-euthanasia propaganda, criticism of the number of people who are being denied their quote-unquote right to euthanasia, and calls to expand eligibility and speed up the evaluation process. We hope that our observations, our sober second thoughts, will not be completely lost in the hubbub. So that's the end of our first subject. Our second subject is shorter. Assisted suicide bills in the United States. Assisted suicide bills have been proposed in several U.S. states again this year. Most have been stopped, but not all. The Patients' Rights Council keeps track of state bills on its website, and here's a rundown of some of the most important results so far. In Connecticut, on April 1st, Connecticut's Public Health Committee decided not to vote on HB 5898, a medical aid in dying bill, which means that the bill didn't advance by the legislative deadline. This was largely due to the efforts of Second Thoughts Connecticut. So hail to Elaine Colt and Stephen Mendelson. Yay, gang. Oh, and Kathy Ludlam also.
Yes.
Yes.
Congratulations, guys.
In Maine, the Pine Tree State, has both a bill before the legislature, which is HB 948, which is still in committee, and a campaign to put a question on the 2020 ballot. So there's a lot going on in Maine. In Maryland, WDVM-TV 25 reported that HB 399, the Maryland Assisted Suicide Bill, was defeated with a deadlocked 23 to 23 vote in the Senate on March 27th. Senator Obie Patterson, Democrat of Prince George's County, did not vote, saying that he had not prepared himself to take a stance on the bill. So another bill died. Yay. Unfortunately, however, Montana, a bill that would have overturned the Baxter decision that legalized physician-assisted suicide, was defeated in Montana by a Senate in the Montana Senate by a vote of 27 to 22. So we'll have to try that again. New Jersey, also unfortunately, the assisted suicide bill, which has been pending in the New Jersey legislature for several years, has finally been adopted. Governor Phil Murphy has not yet signed the bill, and you can call the governor's office at 609-292-6000 to tell him not to sign. Although they tend not to accept people from out of state, it's at least worth being counted. In New Mexico, Representative Deborah Armstrong, an Albuquerque Democrat and co-sponsor of House Bill 90, the End of Life Options Act, said she will not seek approval in the state's House of Representatives because there aren't enough votes to win passage for the legislation yet. She said she has asked that the proposal be tabled for the time being.
And can you what does tabling mean in the US again? It means something different here.
Putting it off the docket for the moment. So basically, yeah, it's off the docket sheet. For it won't be considered anymore this session, and it will have to be reintroduced during the next session, which will start in 2021. In New York, a Medical Aid in Dying Act, known as A2694, was introduced for this year's legislative session, and supporters will have to contend with the 2017 ruling by the state's highest court, which found no constitutional right to aid in dying.
I think we should come back to this one down the road. I remember last summer I had done some research on their previous attempts to introduce assisted suicide in that state.
Yep. And in New York, it goes back as far as 1994. There was a report, a governor's commission reported basically saying assisted suicide is a bad idea. And so then there was this decision that came out in 2017 that was a unanimous decision by the state's highest court that said, no, there is no constitutional right to medical aid in dying. So that was a good decision. And they actually did quote "not dead yet" in the decision. So that was great.
Oh, good.
Yeah. And I think we did cover it in a webcast, but I gave a link to the ruling, but not our webcast on it. Okay. Finally, in Oregon, bills have been introduced to expand and modify the Death with Dignity Act. HB 2232 and 2903 would expand the definition of terminal disease to remove any reference to terminal prognosis.
Well, then how do you know it's terminal then? That is what a terminal condition is.
Well, it's like any condition that will result in death.
Okay.
Period. Life will result in death.
Yeah, pretty much.
In other words, they're opening it up completely. Also, House Bill 2217 would require the lethal dose to be self-administered, but it says nothing about any criminal liability for helping, quote unquote, the person to take the drug. Lovely. Other states where assisted suicide bills have been introduced include Arizona, Arkansas, Indiana, Iowa, Kansas, Massachusetts, Minnesota, Nevada, Rhode Island, Utah, and Virginia. So, and also there are rumors of bills in other states, but we haven't seen those yet. Okay, so if you want more information about the topics that we discuss here, you can visit our Facebook page at facebook.com/toujours vivant, not dead yet, all one word. Visit our website at tvndy.ca. You can send us an email at info@tv-ndy.ca, or you can follow us on Twitter @TVNDY. Thanks very much to Taylor for helping out, and thank you for being there, and we will see you all next time. Bye.
Bye.
And Amy finds